So my name is Sarah Kane, and this is my video for my presentation for my poster for my capstone for C855. The purpose of this project was to create a more comprehensive pain assessment for the laboring woman, because as it is, we are using a pain scale that asks just a numerical 1 to 10 value, which does not give you a whole lot of information. And so in order to be more comprehensive with both our charting and our patient care, we are creating a comprehensive assessment that's a coping assessment to assess how this woman is coping, and then also ask her opinion. Do you feel like you are coping? And then using that assessment, we will put in there a flow sheet that has all the available interventions. So not only does this coping assessment benefit the patient, it will also benefit the provider, as well as showing a more comprehensive picture in the documentation for what's going on with that patient at that time. Above and beyond that, we want it to be still in compliance, of course, with the Joint Commission and the Joint Commission's expectations for charting, and so we had to update the policy to make sure that we were still going to stay compliant. We found that the use of a coping assessment was better, that listing the interventions allowed providers to provide better care, and it gave the patients an idea of what else can we do, how else can we help. We found that patient satisfaction scores increased, our HCAHPS scores were better, and our end user survey for our providers found that they were using the coping assessment, they liked the coping assessment, and they felt like it was another tool that they could use to provide better care to their patients. So this SDLC was developed to design, implement, and then monitor, maintain, and support a coping assessment in lieu of a pain scale, and was measured in success by the patient satisfaction scores and the user survey. We have got first a gap analysis that was created, which is a needs assessment to identify this labor and delivery unit, how they need a more comprehensive plan and what the need is, where the gap is, in order to create a better documentation system. The workflow analysis diagram is in the bottom left of the poster, and it shows when to use a coping assessment and how to use it effectively. What does her pain look like? Can you tell that she's coping? Does she state that she's coping? And if not, what can you do? And you sort of follow the flow sheet from there. Our dashboard showed some survey results for sort of what interventions are these patients using, what should be the most beneficial to put into the flow sheet that lists the interventions. Clearly an epidural was up there because 84% of people got an epidural, and so putting all that data together to sort of see what the best interventions that should be listed in the flow sheet are was critical. The dashboard diagram also shows sort of the difference between pharmacological and non-pharmacological interventions, so it's important to list sort of the non-medicine interventions as well as the medicine interventions for those patients that feel like they don't want to do an epidural or they don't want to have IV analgesia. The ERD was the entity relationship diagram was created to sort of show how everything is related. So each entity and their corresponding data elements is sort of put together to show how you go from the patient into their chart, and then what part of the chart is important to show how they're coping and when they're coping, and if they're not coping, and then what we've done to support that. The SDLC graphic is put together with a Gantt chart that sort of showed our timeline and what the project was going to look like, staying specifically within the expectation from the Joint Commission. So starting with that policy change and sort of building on that to go from creating the policy internally to rolling it out on the unit to making sure that the unit is compliant to then following that up with what is this changing? Is our patient satisfaction score getting better? Are our providers using this coping assessment? Do they feel like it's useful? And so for the maintenance and monitoring plan to follow that up with the survey was asking, are you using the pain scale still? Are you using the coping assessment? Do you feel like your patient says she's coping when she's really not coping? And just sort of breaking it all down into, do you feel this is useful? And if not, why not? Because if there's something that needs to be changed, we can change it. Or if you're finding a way to work around, can we stop that? And sort of finally, is the coping assessment making a difference? Are our patient satisfaction scores looking better? We use a couple different resources. that showed that patient satisfaction scores are extremely important, and we showed sort of the use of a survey for rating patient satisfaction scores. So does it make a difference for your HCAHPS? Does it make a difference in real life? So can we use this survey both with our providers and with our patients in order to make a difference and provide them better care?